feeling tired all the time, I'm going to tell you why that might be and what you can do about it. I'm Dr. Sidhu, and I am a family practice and a lifestyle medicine doctor. I'm also the proud founder of Spring Monarch Primary Care, which is a direct care practice here in Houston, Texas. If you want to learn more about my practice, I've linked it in the captions, so check it out. All right, so let's first explain that the difference between tired and fatigue. So tired is if you sleep 8 hours, you wake up, you feel pretty good. Fatigued is you sleep 8 hours, sleep 10 hours, and you still don't feel good, right? Tired is walking up 5 flights of stairs and feeling like you need to kind of catch your breath. That's normal. Walking up 1 flight of stairs and needing to catch your breath, needing to sit down, that's not normal. Running a few miles and feeling really tired, that is normal. Walking a mile at a slow pace and feeling absolutely spent, that is not normal. So what we need to understand is that when we feel fatigued, when our body has a difficult time recovering, our body is sending up red flags to say, hey, something isn't right. So today I'm going to tell you about the top 5 reasons I see that people feel tired in my clinic and what they can do about it. The truth is, one of the most common questions I hear from patients is, why am I so tired and what can I do about it? Well, I'm going to tell you everything I tell my patients here in this video, so keep watching. I'm going to give you the top 5 reasons that I see in my clinic. All right, let's dig in. Number 1, we are going to start with metabolic and hormone health. When I say metabolic and hormone health, these disorders can often be detected by blood tests. So let's talk about those. Number 1 reason I see is often diabetes, uncontrolled sugars, varying sugars throughout the day. So an easy way to check to see if you have a sugar problem would be by checking your hemoglobin A1C, which is the average of your sugar over 3 months, your fasting glucose or fasting insulin. This is a super important test because 1/3 of Americans might be pre-diabetic. So if you are tired all the time and you haven't had your sugar checked lately, that's a good way to start, okay? Number 2 is thyroid health. The truth is that at some point in their lives, about 12% of Americans will develop some kind of thyroid issue. And having a thyroid issue can lead to fatigue, constipation, dry skin, dry hair, weight gain, and all kinds of things. So when a patient comes in feeling tired all the time, I like to throw that thyroid test in there, particularly a TSH, to make sure that nothing is going on with their thyroid. The third thing I like to check when we're talking about metabolic and hormone health would be hormones, particularly if someone is in their middle age. So for men, for you, I would like to check your testosterone. For women, the type of hormones I check varies based on their age and the symptoms that they're having. If they're in the perimenopausal range, which can start after the age of 35 or so, I'd be checking their estradiol, their progesterone, testosterone possibly, depending on their symptoms. And then also if I'm working up PCOS or other kind of menstrual cycle irregularly, I might check FSH, LH, though some of those disorders can also be diagnosed through symptoms. So looking at the overall metabolic and hormone health is really, really crucial when people come in with feeling tired. Okay, number 2. The second thing we have to look at is nutrition. I know people say it all the time. You are what you eat. You got to eat good to feel good. But let's talk in particular what I'm talking about. Okay, first thing is that if you have a high sugar, high carb meal, you're more likely to crash in the afternoon around 3 p.m. Okay, so if you want to avoid that 3 p.m. crash, having 20 to 30 grams of protein at breakfast is super important. The next thing I see like all the time is people will have a very carb heavy lunch and then feel like they need to take a nap after lunch. So really getting enough protein during lunch is super important. The third thing I see very, very often is too much caffeine. And here's why caffeine can lead to fatigue. Number 1, think about caffeine as borrowing energy from later in the day that you might not have. So when you drink that cup of coffee or several cups of coffee, you might feel really great, but later in the day you crash and you just feel absolutely exhausted. The next thing I see with coffee is Coffee can last in your system for 5 to 8 hours. So if you have a late cup of coffee, if you have caffeine with dinner, it can disrupt your sleep for the entire night, which then makes your next day kind of not feel good, right? So making sure that you're not having carb heavy meals and making sure you're getting enough protein at your meals and limiting caffeine can be a great way to alleviate some of that tired and fatigue feeling. Number 3, we are going to talk about undiagnosed sleep disorders. Super, super important, because sleep equals efficacy, which means that if we don't get our patients to sleep, nothing else gets better. If you have sleep issues and you're not sleeping well, it can lead to weight gain, diabetes, high blood pressure, cholesterol problems, mood disorders, and all kinds of things. So assessing a patient's sleep is super, super important. And today in particular, I'm going to talk about undiagnosed sleep disorder called obstructive sleep apnea. Obstructive sleep apnea happens when the patient doesn't get enough oxygen in when they're sleeping. And this can happen for various reasons. If they happen to carry a lot of weight on their chest, if they have a smaller jaw and it gets recessed at bedtime, particularly certain ethnicities are more prone to that. If the anatomy in their throat is different and it kind of closes when they lay back, these are all risk factors for obstructive sleep apnea. And one of the main signs that we see of obstructive sleep apnea is snoring. Okay, snoring that you can hear from outside the room on the other side of the door. That's what we're talking about, obstructive sleep apnea. So if you wake up not feeling rested, if people have told you that you snore, it might be time to talk to your doctor about a sleep apnea test. The good thing is that we can do home sleep studies. They are fairly affordable if you go through the right company. And if you have sleep apnea, we have ways to treat that. And then we can make all your metabolic and other issues better just by getting you to sleep. All right, number 4, we are going to talk about something that I think a lot of doctors don't even know to look for, and that is food sensitivities. 1 in 5 Americans can have a food sensitivity. And other than stomach issues, fatigue is often the next most common presenting symptom for food sensitivities. So if a patient comes into me and feels really tired all the time, fatigued, I look at what they are eating. And a good way to do that is with a food log. So you write down everything you're eating, and then next to it, you write down how you felt afterwards. Keep in mind that some food sensitivities can cause symptoms up to 72 hours after you eat that food. And sometimes it can cause symptoms like the overall picture. And one of the reasons that food sensitivities cause fatigue is because it can cause nutritional deficiencies. If you're eating something and your body is fighting it, it doesn't absorb the rest of the nutrients that was paired with that food. So over time, these nutritional deficiencies, poor absorption of food, can lead to fatigue. So food sensitivity is super, super important. The most common, of course, is gluten sensitivity. I, for instance, have a sulfite sensitivity, and if I eat a lot of sulfites, it makes me feel terrible. I have another video about sulfites, so if you want to watch that, go back and watch it. It'll tell you everything you need to know about food sensitivities and sulfites. All right, number 5, and this to me is one of the most important reasons that people feel fatigued. And if you take away one thing from this video, I hope it's this one. All right, the 5th reason, the most common reason I see fatigue in my clinic is cardiac fatigue. The truth is that cardiac problems can cause fatigue years, even decades before the first heart attack or stroke. So it is super important when someone comes in with feeling tired all the time, fatigue, especially if they have risk factors like high cholesterol, a higher weight, family history of heart disease, history of smoking, history of diabetes. All of these are risk factors for heart disease. So if someone is coming in feeling tired all the time, complaining of feeling tired, I want to assess their cardiac health. And how do we do that? So there's numerous ways we can do it. We can check their cholesterol. We can check their specific cholesterol markers to see if they have the higher risk cholesterol. We can check CRP. Also, I can send them to a cardiologist and they could have a stress test. But one of my most favorite tests that we order right now, just in general, is the cardiac calcium score. And what that does, it assesses how much plaque you have in your heart by detecting how much that plaque is calcified. So it's a quick CT scan of the heart, takes like 5 minutes. It's often not covered by insurance, but in most places it's less than $150. So if someone has a strong family history of heart disease in a first-degree relative, I might do that calcium score after the age of 35. But the standard is at 45. So if a patient is around 45 years or older and they're feeling tired all the time, one of the test that I love to order is a cardiac calcium score, because it tells us that a person has plaque before they have their first heart attack or stroke. And then we can go ahead and treat that plaque with medications and lifestyle to hopefully prevent a heart attack or stroke in the future. All right, so these are the top 5 reasons that I see people feeling tired in my clinic all the time. If you want to work with me and figure that out and you live in Texas, there are other tests that I can do besides these 5, and there are other things that I look at for fatigue. So this is just sort of my starting point. There's other things like autoimmune diseases, supplements, medications, all can cause fatigue. So lots of things to unpack here when we're talking about fatigue. So if you live in Texas and you want to work with me, I have linked to my practice in the caption, so please be free to check that out. If you liked this video, please don't forget to hit like. Please share this video with a friend or family member who you feel needs to hear it. Maybe you have someone that you know needs to get a cardiac screening. Maybe you have someone you know that snores and probably needs a sleep apnea test. Or maybe you're like, this person should probably get their sugar checked out. Please be sure to share this video with them. If you want to see more videos like this, please hit subscribe, and I will see you guys in the next one.